Okay, so today in this video, what we're going to be discussing is I'm going to be talking to you about, I'm going to go through all the pre-meds for the chemotherapy, the chemo drugs. The previous one I was on, I have a short discussion about that, as well as the new one that I'm on right now that the pre-meds are for. Then I'm going to discuss with you the HIV meds, what they are, what they do, what they look like, and the side effects from them. And then I'm going to show you also an antibiotic that is given to me as well to prevent pneumocystis pneumonia, which is also it's called PCP. It's the one that usually if an AIDS patient dies of pneumonia in the hospital, chances are it's that pneumonia, it's PCP. So we're going to start off by discussing about ranitidine. It's the first pre-med that I'm on, as you can see in this video, as this clip.
Just a little bit,
This one is used for the stomach. It's to prevent, it's ranitidine is the same thing as Zantac. It's given through me, obviously through the IV, and it's to prevent stomach acid prevent my stomach from developing too much acid and giving me heartburn and whatever else that might happen. If I have to go to, if I for some reason police or whatever decides that they need to they want to give me a test for methamphetamines, it can actually give, because I'm on this medication, it can actually give a false positive for it. I don't need to worry. I've never seen meth in my life, so I'm not worried about it. Even if they tried to tell me I was on it, I'd tell them full of it. Nonetheless, that's what ranitidine is for. The second one here is dexamethasone, as you see here.
These are the three pre-meds that I'm about to...
This one here is used as an anti-inflammatory, which obviously is because of the chemo drug itself can cause inflammation in the body. This one here prevents the inflammation from happening. It's an anti-inflammatory. This drug also is also, if given in high dosages, is also used for anaphylactic shock. And so that's the second one. That's what the second one is for. The third one, diphenhydramine, also known as Benadryl, as you see here in this clip. Well, this stuff here is used to prevent any kind of allergic reaction that I might get from the chemo drug itself. So those are the three pre-meds that I have to take, and that's what happens. Now I'm going to discuss about the chemo drugs themselves. The Kalex, I have no clippings of that or anything else, and as I said in a previous video, that stuff kind of looks like orange Tang or orange Kool-Aid. That stuff there was given to me intravenously for 30 minutes, and I was done. And the only side effect that I got from that really was just a little bit of fatigue. Not too severe. Nothing like this stuff that I'm taking now. So, I mean, that stuff was called Kalex. This drug, it's called paclitaxel, or otherwise they call it in the hospital Taxol. This stuff here comes from the bark of the Pacific yew tree. It's what do you call that? Infused, I guess, from that, and yeah, I mean that's where this drug is from, and that's what it's called. Okay, so now that I've discussed all the pre-meds and the chemo meds, as I've mentioned in a previous video of how severe the side effects were of the paclitaxel, then I'm not going to get into that right now. I already talked about that. I'm going to be discussing with you all the other pills And I'm going to use an American penny, so it's the same size as the Canadian penny, but I mean, for you Americans never seen an American or a Canadian penny, you've definitely seen an American one. I'm telling you, it was a pain in the ass to find one because I got lots of pennies, but not too many American ones. So I'm going to be going through. First, I'm going to be showing you the anti-nausea med. It's called the football pill. They always ask you before I go to chemo. Well, when I'm starting the chemo, before they administer the pre-meds, they always ask me if I've taken this pill. I never do take it because it's for nausea, and I don't get the nausea from it anymore. I just got it the first 3 or 4 times, and then that was it. It's never again. So, but I'll still show you what the pill is that they give you because they give it to everybody. And I'll show you and discuss with you each of the HIV meds and what they do and what they look like. I'm using American penny to illustrate to you the size of these things. Okay, and then I'm also going to show you the antibiotic. So, let's start with the first pill. Okay, so this is the football pill that they get us to take, and as you can see, this is an American penny. See if I can zoom in and get a better look, show you. See if it will zoom in. No, it won't. But anyway, as you can see, there's your White House and whatever else you guys got on there. So nonetheless, okay, so this is our football pill, and this stuff here is called ondansetron. I'm not good with these names, so I've never seen this stuff before. But this stuff here, as you can see, ondansetron. Okay. Oops. Ondansetron. So okay, I take 1 tablet, say twice daily, I guess. Yeah. So that stuff there is used for the anti-nausea. You take it before chemo. Again, it's sort of like a pre-med, but you're supposed to be taking it every day anyway. So now we're going to go on. That's for anti-nausea of the chemo. Now we're going to be discussing. Again, I'm using the same American penny, then to illustrate to you the size of this pill. Okay, so as you can see, anyway, this is big enough. Okay, it's about as long or about as wide as your penny, if not a little bit bigger. And this one here is called Truvada. Now, what this one here is 200 milligrams of Emtreva, FTC, I think, and 300 milligrams of Virete, tenofovir DF. Now, what this stuff here is, it's in a category of HIV meds called nucleoside reverse transcriptase inhibitors. It prevents HIV from altering the genetic material of healthy T cells. This prevents the cells from producing new virus and decreases the amount of virus in the body. So I already knew that this stuff here reduces the viral load. Okay, so that's that one. Side effects are you can get these side effects can affect both men and women. Weight gain in the abdomen, breast, and back of neck, and cause basically it causes nausea. And it's got to be taken once a day, every single day, but once a day. I got to take the rest of these twice a day, except for this one here. So I've got 1, 2, 3, 4 of these pills. Take every single day, twice a day, but just this one here only once a day. So here we go on to the second one. This stuff here is called Prezista. Okay. Now, what Prezista is, and as you can see, I'll show you what that stuff looks like. Okay, that one there is much bigger, as you can see. Okay, this is called the protease inhibitor. Prevents the CD4 cells that have been infected with HIV from becoming HIV factories. Side effects are nausea, vomiting, diarrhea, may cause fat in the abdomen, breast, and back of neck, and decrease fat in legs and arms, face. Also may cause diabetes. So, this one here is a protease inhibitor,
So, I mean, two of these seem to be reverse transcriptase inhibitors, and two of them seem to be protease inhibitors. So that's what that one is. Now, the third one, this is called Norvir or ritonavir. So I'm going to show you that one. Okay, as you can see, this goes. I've been on a couple of regimens, and I'm going to tell you, this one here is always included. Okay, and this too, I believe, is also a protease inhibitor. So it does the same thing as what the Resista just did, what I just mentioned about the Resista, and it's got the exact same side effects: nausea, may cause decreased fat in the face, lips, and all that, and increased fat in the breast, stomach, and back of neck. Okay. Now this third one, the last one here. Okay, again, I'm going to use the penny to illustrate the size of this thing. Okay, it's called Viramune or Nevirapine. Now, I've done some research on the internet. I've seen a documentary about Nevirapine, and it's got some nasty side effects for some people. I didn't get any side effects from it, but I know others who have. Well, I don't know anybody who has, but I mean, I've seen people on the documentary who really did have some bad side effects from it. Now, this one here, what this one here does is it's a reverse transcriptase inhibitor, and it reduces the amount of virus in the body, and it helps increase the CD4 counts. Now, the more CD4 counts you've got, I mean, those are the important ones, the better that you can fight off infections. So those are the meds. That's what they look like. Okay, so another med, this is an antibiotic, it's called Atovaquone or Mepron. Okay, this stuff here, as you can see, it says take 2 teaspoons daily. Okay, and I'm going to tell you from my own experience, this stuff tastes nasty as it is, but the first teaspoon, okay, that one you can get down. The second one tastes about 100 times worse. I mean, most people, I haven't seen anybody who's been able to do it that easily. The way I was doing it when I was on it was 1 tablespoonful, and it tasted just like the first one. I'm going to show you what this stuff looks like. It's a yellow color. Okay, and watch this. Let's see. Look how thick this stuff is. Now, if you want to have to be taking that every single day, now this stuff here is used to prevent the pneumocystis pneumonia, which is the pneumonia that usually kills most people, and it's to treat it and to prevent it. So, that's what that stuff looks like. And when you develop full-blown AIDS or you're close to it, I mean, they probably, once your CD4 counts reaches below 200, they put you on that. So this is my regimen that I'm on a daily basis. This is my morning dose that I take, and this is my evening dose every 12 hours. So, you know what I mean? This morning, all 4, and the evening, just those 3. You know what I mean? So, this is what these are the meds that I neglected to take and develop full-blown AIDS.
So, for those of you who are HIV positive, if you don't want to have to take the Atovaquone, the yellow stuff that I showed you, take your meds correctly. Don't let your CD4 counts drop below 200, because most likely the doctor will put you on that, and you don't want that. You have to take that every single day. It's an antibiotic. And make sure you take your meds correctly every day. Otherwise, I screwed around with mine for 6 years, went on and off, on and off, on and off, and I ended up developing full-blown AIDS. They also, nowadays, the doctors call it advanced HIV. It's still full-blown AIDS. We know it from our days as full-blown. For those of you who are HIV negative, now you can see what our medications, one of our regimens, what they look like, and exactly what these medications do inside the body, and how we're able to control the virus and remain healthy for as long as possible. The only problem is that these meds, they're very dependent on the liver, and it will eventually cause liver problems.